Welcome back to another episode of ATtalks. This is Todd, your host. We're still we're still doing the athletic training student guide. This is our second attempt because I messed up the recording on the first time. We're with Rob, Paul, Tony, Ed, and Capital A. This is episode 6 or 7. Today we'll be talking about professionalism, hosting, and the medical timeout. So go ahead.
It's funny, if you look up the definition of professionalism, it basically says the competence or skill expected of a professional. What the hell does that mean? Yeah, so we all kind of come up with our own definition of professionalism. Kind of the way I see it is, how do you represent the profession that you work in?
I like it. This is a challenging topic for me because some of it is, again, I agree with Paul in regards to representing the profession. But sometimes, with the majority, people can kind of put you in a box on what they think, the professionalism should look like. And that not everybody always fits in that box. So sometimes this is a little challenging for me. But at the end of the day, for me, it is understanding the culture of the profession. It's understanding the population that you're going to be caring for and treating for, and making sure that, yes, you do represent yourself in a way that people do acknowledge you as a healthcare provider. People know that you're coming to provide them high quality athletic healthcare service. But sometimes I'm always a little concerned that, with professionalism, a majority will make it feel like you need to look, sound, dress, and present yourself a certain way. And that's always not the case. So I think it's a challenging topic to discuss. And at the end of the day, I just always express to operate with wisdom. Again, understanding the culture that you're working in, the population that you're serving, and again, making sure that you are truly putting yourself in a position that you're acknowledged as a healthcare provider.
I'll add, as we already know, each one of us is going to have some great insight on what we believe the word means. I agree with Paul, and it's simple, right? When you think about how we use that word, I think that's what can be, I don't want to say misleading, but that's what can cause differences. I'll put it that way. To me, professionalism is how you handle yourself in situations. We already know, a lot of times you don't want to rock the boat, but at the same time, if you don't create change, sometimes things don't happen, right? And it can be a tightrope sometimes, being that person to want to create change and want to do things the right way, and still having tact. I'll use that word when doing so. And it's real funny when we're having this conversation. I actually had a situation recently, I'll say it that way. I had a situation recently where my professionalism was challenged a little bit, to be honest. And in any situation, my thoughts are to always treat people the way I want to be treated, right? And then sometimes you can't help but to say, look, this is how it is. This is how it is. This is how it's going to be. When you feel someone is coming at you a certain way, you got to let them know, like, that's not needed, and some would argue that that's not professional or not. But, I go back and say, well, when I tried to be tactful and I attempted to come at you in a more subtle way, it didn't work. So now, yeah, sometimes you have to pull rank, or sometimes you have to, be more stern than others. And sometimes you have to raise your voice. And some people don't see that as professional, but I think it is, because sometimes that needs to be done. You just have to know how and when to do it. And if it's provoking change or making sure you get things right or making sure the communication is all together, then I feel like it's warranted. But and it is a slippery slope sometimes, and you have to understand when to use that and when not to. But at all times, be the person you want others to be to you. I think that kind of, for me, solves it a little bit.
Yeah. For me, the concept of professionalism is confusing because the way I was brought up through a program, I like the definition you gave us, Paul, because professionalism should be about, can you perform your job and represent the profession well? But when I was an undergrad, like when we get our end of clinical evaluations, under the professionalism is appearance. And I remember seeing athletic trainers from other institutions or other students, and you hear the comments, wow, they don't look really professional, or oh, tattoos aren't professional, and you're judging them based on how they look, but they could be a very solid athletic trainer, which, I mean, if they're certified and they've gone through a program and everything, they are solid as a professional. So I'm trying to get out of that now, because being a preceptor myself, I have had those conversations with students who have had arm sleeves and be like, hey, those might be things you might have to cover up because employers may not like that, or like your hair might be too long, because that's how it was ingrained. But now I'm to the point where I'm dropping all that. I personally don't mind tattoos. I don't mind people having long hair, where before it used to bother me because that was the message that was passed on to me in my education. So I think the focus on professionalism has always kind of been directed in the wrong direction. And we kind of need to bring it back towards actually being athletic trainers and not looking like athletic trainers. Because who's to decide what athletic trainers look like Tony was saying.
See, and I like what you bring up, Ed. Again, a lot of times there has been focused on the look. And like I said, for me, I don't know if there's a true right or wrong. But for example, if I was working in the clinical setting and I was working for maybe a more older population, conservative perspective population, like I said, I may, want to have a long hair, I may want to have tattoos and so forth, but also do need to be, I also do need to be aware of what community I'm serving as well, and respect the culture that I'm serving, and be mindful, right? Because at the end of the day, if you're trying to serve this community, you want to be received with this community. And regardless of, I should be able to wear what I want, look how I want, and still people treat me, appropriately. That's a fair statement, but this is still the real world. So I'll operate with wisdom, right? Because there is no right or wrong. I think you should be able to have tattoos if that's what you truly want to have. If you want to, have your hair colored and presented in a certain way, that's fine. I get it. At the same time, I think we all need to be aware and operate with wisdom on what community we're serving, right? In the sports world, there is a little bit more, I think, openness. There is a little bit more, acceptance and differences, because in the culture world, teams, you bring so many different people with so many different backgrounds, religious beliefs, characters, and so forth, that in order to actually have a successful team, a coach has to be able to bring those differences together and compel them. And I think when it comes to sports medicine, and working in those settings, there is a little bit more flexibility. We need to be open to that. But at the same time, if you are working in a very conservative clinical setting, just know that there's going to be challenges. If you want to embark exactly who you are, you may meet some bumps in the road, and it may not be your employer. It may be the patient who just doesn't like how you're presenting yourself.
I think my thoughts go along with a lot of the things that Ed has said, and some of the things that Tony just mentioned, in the way, professionalism has something to do with dress. But my overall definition and the thing I strive for to be a true professional is that my hope is that people will look at me, see me walk on the court or the field or whatever. I work in a secondary school setting, so I'm on a lot of different venues, and people will see me walk in the room or walk in my athletic training facility and know that I'm the one that's in charge before I even open my mouth. That could be the way I dress, could be the way I carry myself, could be the way I interact with people around me. So professionalism for me is not just how I appear to other people, it's the whole, really the whole package of how I present myself, how I interact with patients and supervisors. And to share a little bit of a personal story, recently that kind of came back to illustrate how well, maybe even too well, that my definition had been working for me personally. I was sitting down in a meeting with one of my supervisors, the athletic director, and they asked me a question about my status and my contract. And they said, are you, in your contract, are you the head athletic trainer? And I said, I really don't know. I work with one other secondary school athletic trainer in our high school. And for all I know, we are equals. We don't have special titles or anything. It's just the two of us. So there's no really head and assistant. But they kind of referenced that, let's say we had a question and someone came to ask the other athletic trainer, my partner in the athletic training facility, and another person suggested, well, make sure you run that by Andrea first because she's the head. And it's nowhere in my contract, as far as I know. We don't have any official titles on our door or anything, but I believe it's probably because of the way I have conducted myself, being proactive and reaching out to be part of the healthcare team within the entire school, that kind of set me apart a little bit. And the assumption was made that, this is she must be the head because this is what she does, or this is how she conducts herself. It was really kind of a cool moment, kind of humbling. But there really is I don't have many rules about dress or about, tattoos and hair or whatever. It's more about the image I want to project to everyone that makes me a professional.
When I started this, I started with a really simple definition to get the conversation rolling. But to take it a little deeper, to be a professional, you really need to be self-aware of how you appear and self-aware of what your knowledge, strengths, and weaknesses are. So when it comes to appearance that Ed and Tony were first start talking about, when it comes to tattoos and dress, if I got a big neck tattoo of a naked lady and I'm working with 8th graders, that's probably not appropriate. If I'm working in the WWE or mixed martial arts, who cares? Not a big deal. So being where you are and what you look like, there's a lot of self-awareness there. There are a lot of people that I say need better friends. When people try on an outfit, you often ask your friends, hey, does this look all right? And how many people go, yeah. There are certain outfits that don't look good on certain people. There are certain people that can wear blue jeans and a button-down shirt and look professional. There are others that can't, and you have to know what you look like. If you don't look like good in blue jeans and a button-down shirt, you shouldn't be wearing it as a professional. If you do, great. So there's perception as well as self-awareness, and that goes back even to what Rob was saying in your communication skills. And if you have a bunch of fancy tools in your room because you look really cool and really professional, but you don't know how to use them, how professional are you? So all of that self-awareness and self-knowledge and understanding your strengths and weaknesses, they all go hand in hand in how you represent the profession.
And over time, go ahead, Rob.
No, go ahead, Tom. Go ahead.
I was going to say, and over time, your own definition of professionalism and what you like and what you don't like will change. When I was a student, it was, polo, dress pants. I'm the medical provider. Don't care about your life. What's going on with that knee? All right, get out of here. Don't leave your backpacks in the room. But now it's like, hey, how's your life? What's going on? Yeah, you can leave that backpack in here. Oh yeah, I got food over there. There's some oranges. Go take one, brother. And you just change, and that's okay.
Yeah, and Paul hit it on the head. Again, like I said earlier, we're all going to say, the exact things because of the experiences we all have, right? But one of the things that Paul said that struck me the most is it is perception. It's how people view you. You know what I mean? I'm not a huge khaki person, right? I just never.
Let me just say this. Let me interrupt you, Rob. Khaki is a color, not a style.
I know.
Okay?
That's what I've said too. And I'm like, and that's the thing. I'm not a huge khaki person. I'll wear my Dockers, right? I'll wear
Mhm.
my slacks, my dress pants. I like blues, blacks, and grays. I don't like khaki. Now, every once in a while, because I do have them, I might throw them on, but that's just me. But like Ed was saying, it was ingrained in us coming through the process. I remember when I worked with the Falcons, we had 4 pair of khaki shorts, the same brand, the same color, the same, and that's what you wore, right? When you're in the athletic training room. Then we had our cotton shorts that we wore out to practices and outside. But